Hello, thank you for joining us. This is Mike Mulqueeny and Doug Hessel from Johnson & Dugan, and today we're going to do a short, less than 10-minute overview on cost shifting versus cost containment and the impact that has on employer medical plan design.
Hey, good to see you, Mike.
You too, Doug. Thanks for joining me. So Doug and I have both been in the business for over 30 years. We've worked with some pretty notable companies through our careers, from different to employer groups such as top technology companies, life science companies, law firms, nonprofits, schools, and VC firms.
We've been at it for a long time, Mike.
We have, and it looks like we both use the same barber.
We do.
I know. So Doug, who said it? We face a massive crisis in healthcare costs. Without prompt administrative and legislative action, we will have a breakdown in our medical care system.
Well, Mike, I know the answer, but
Yeah.
does our audience? So let's give them a little bit of time here.
Okay, well, everybody got 3, 2, 1, and your answer is?
Tricky Dick Nixon.
Wow.
50 years ago, Mike, the same problem in front of us. And in some ways we've come a long way. In many ways we've not come far at all. So.
Yeah, it's really too bad. What I've been dealing with in the last several years is cost shifting, and that means different things to different people in the spectrum. For the CFO, why don't you? Yeah, what do you think the cost shifting means to the CFO, Doug?
Yeah, I mean, the cost shifting is from where your seat is. I mean, it means different things to different people. But for the CFO, it's really just about the bottom line, not to stereotype them, but that's what they're about, managing expenses.
Yep.
And for a cost shifting from HR is a whole different kettle of fish. I mean, they really have a different perspective. They're trying to balance between the bottom line to the company and also how this is going to affect the employees and their families and recruiting. And then last but not least, the employees and their families, which includes the CFO and HR, I might add. But yeah, cost shifting for employees has to do with their deductibles, their out-of-pocket expenses. How much is healthcare going to cost?
I know it just really seems to of late been putting more burden on them when they need to receive care.
Yeah.
Yep.
Yep.
So we have some trend lines recently in recent years, and what we're seeing, Price Waterhouse said in an article that to drive medical cost trends down, employers are taking a more active role in managing health care. So what that really means is, they're negotiating some of their own contract prices, their own provider networks, and even building parallel health systems to take care of their employees at a more manageable cost. And a lot of this is done because when you're doing this, you get more transparency, real transparency in what's going on within the plan, and that allows the ability to see what's going on and approach some solutions to try to drive costs down.
And for the first time, Mike, we're actually seeing these solutions be available to the mid-sized to smaller employer groups. The large groups have taken the initiative. They've been fighting the battle, and now it's trickled down to our clients, which we're excited about.
Yeah.
So, this is just a short piece about in the Wall Street Journal having to do with the average cost of healthcare nationally for families. This $20,000, but Mike, you and I know many of our clients are paying $30,000, $35,000 a year for family coverage in the San Francisco Bay Area. So this is just, it can't continue, and our clients are struggling, the employees are struggling, so we need some good solutions.
Yeah, we do. And, the Kaiser Family Foundation has basically, stated it's no longer just about a 6% trend. Employers are now viewed as part of the healthcare industry or the system because they're paying for the coverage and bringing the benefit plans to their employees. So it's really now more about the inequity in costs that we see when we have transparency and the misaligned incentives across the board that really don't support the idea of cost containment.
Yeah, wouldn't it be nice to have the alignment of incentives be, equal from the employer down to with the insurance company and also with the patients or the end users? Yeah, the hard truth is, cost shifting is a lose-lose. We all know that. It's a kick the can down the road, whether it's the government cost shifting to employers and the employers cost shifting to the employees. It's just a short-term, dead-end strategy, and, frankly, I'm tired of talking about it, Mike. We have some better things to talk about.
We do. So is cost containment possible? Doug?
Yeah, I mean, here are the major components of the provider system. The hospitals, yes, absolutely. Specialists, yes, cost containment possible. Primary care providers, they've done a great job in the trenches. They're the people in the trenches. They've been fighting this battle for a long time. Not so much. I mean, I think they're pretty darn cost efficient.
Yeah, and that's not really where the large dollars are sliding out of the
Yeah, and we know what the pharmaceutical companies are doing, and that's getting a lot of national press, as it should be, both national and from a state point of view. So how are Bay Area companies attacking the problem? Well, there's one group that's been at this for a long time, Mike, the Pacific Business Group on Health. For over 30 years, it's been a consortium of large employers really trying to tackle this problem. They focused on three main areas in their initiative. Accelerate transparency, I mean real transparency, not fake transparency of healthcare costs. They want to pay for value. In other words, they want lower cost with better patient outcomes, clinical outcomes. And a lot of it has to do with redesigning the healthcare delivery system, which is actually starting to happen in a big way in the Bay Area.
It is, and these are the sorts of things that we're doing with our clients.
Yep. Yeah, so new options. I mean, a lot of this started with Medicare during the rollout of the Affordable Care Act. Accountable care organizations have to do with Medicare, the Medicare population, and this is basically a system that was set up, a system of carrots and sticks to incent providers to provide cost-effective health care to the Medicare population. But this is filtered down into some really interesting new areas like the Sutter-Aetna Alliance. Sutter Health is a high quality but known as a high cost also provider in Northern California. But the new Sutter-Aetna Alliance is really interesting. They are really after cutting the cost down and improving the patient outcomes for people. I'm excited about it. Stanford Health Alliance doing the same thing, Canopy Health. So the providers are getting on board. It's all about the alignment of the incentives now.
It is. And you know what? This really kind of lends itself, and this is what the Price Waterhouse and the Kaiser Foundation quotes earlier are all about. So, you can do nothing and just be on the same, treadmill that you're on now with regards to your cost of care. We can wait for the government, and we see where that's taken us.
50 years. Yeah.
50 years since Richard Nixon first mentioned it. Or expecting more from your broker. This is really who should be driving this conversation for you, and these are the types of conversations we're driving with our clients. Doug and I would love to come and share with you some granular detail on what we might be able to do for your company. So give us a call or send us an email. We'd love to come out and share more with you about this subject.
Yep. Thanks, Mike. This has
Thank
been
you,
great.
Doug. We did it in less than 10 minutes. Actually, less than 8.
Yeah, thanks for your time.
Have a great day, everybody.
Okay, bye.